Hey everyone, thanks so much for joining. We're just going to wait a few more minutes for folks to keep on trickling in, and we'll get started shortly. All right. Well, hello, and we are so excited to all of you who could join us today. And we have a great case study and conversation ahead of us with Linda and Carlos from Miami-Dade County. Well, transit ridership, as I'm sure you all know, has been declining globally during the pandemic. Miami-Dade County was in the unique position of actually increasing ridership on several of its high-frequency corridors during the same time period. And today we're going to dive into how Miami-Dade Transit quickly adapted during the pandemic to reach more people and to do that, and their plans for the future as part of their city's bus network redesign to grow those same principles. All right, so here's a look at our agenda for this webinar. We'll start with introductions in just a moment. Then we have a presentation from Linda and Carlos, and I'll guide some questions with Linda and Carlos, and we'll close things out with a live Q&A session for you, the participants. All right, so before we get started, I want to quickly introduce myself. My name is Tim Storer. I'm a senior customer success manager here at Swiftly, who partners with several of Swiftly's customers around the country to make sure they are reaching their maximum potential with Swiftly's products and in creating a great rider experience. I've had the pleasure of working with Miami-Dade County for about 18 months now, and in particular with Carlos and Linda on a variety of projects pertaining to data analytics, vehicle tracking, and passenger information. So Carlos and Linda, without further ado, I'd love to give you a chance to introduce yourself and also to share a bit of information around Miami-Dade County, your coverage area, ridership, et cetera, and speak to what's top of mind for you right now.
Excellent. Well, I'll let the details to Linda, but good morning, good afternoon, everyone. My name is Carlos Cruz Casas. I'm an assistant director at the Department of Transportation and Public Works for Miami-Dade County, overseeing strategic planning division. I know it's somewhat of a long name that doesn't describe perhaps what we do. I like to consider ourselves a mobility management agency. We deal with traffic, signals, signs, highway engineering, bicycle and pedestrian, transit planning, transit operations, and even for hire regulations for hire vehicles, taxis, and limos. Linda?
Hi everyone, I'm Linda Morris. I'm the Chief of Service Planning and Scheduling at the Department of Transportation and Public Works. As Carlos mentioned, well, as everyone's mentioned, we are a county, so we cover about 3 million in population size, and our pre-COVID daily ridership was about 180,000 daily riders.
Great, thank you both. And so before we get started, I want to just do one quick bit of housekeeping, which is I want to review the questions functionality on the webinar software for those of you who aren't familiar with it. So on the bottom of your webinar window, you'll be able to see a small Q&A button. And as we go through the webinar today and we get into kind of the weeds of this presentation, feel free to ask any relevant questions there, and our team will be monitoring that channel. And when we wrap up the presentation, we'll be sure to address as many of those questions as we can at the final piece of the Q&A. So just as a moment right now to test that and make sure everyone's comfortable with it, I'd love for you to just go ahead and just type in kind of where you're calling from so we can make sure that's working well. All right, I see New York, I see Washington, DC. I see some others coming in, Miami. All right, great. So it looks like we are set up technically and folks are ready to go. So with that, we'll continue honored with the presentation and dive in. First and foremost, for folks who may not be as familiar with what Swiftly is and how we work, I'll give a really quick overview of this. So we are a big data platform for public transit. We serve over 100 agencies around the world with a variety of products to support their operations and decision-making. And Swiftly has 3 broad product lines, each of which is in use now at Miami-Dade County. There's transit time for providing accurate real-time information to passengers. At Miami, Swiftly's GTFS real-time information goes to, I think, over 12 different applications now, including some of the big third parties, Transit app, Google Maps, as well as digital signage and a 5-digit text for ETA phone number. There's also Insights, which is a suite of tools for analyzing historical performance within things like on-time performance, run times, average speeds, dwell times, and more. And lastly is Metronome, our modules for real-time operations management. And that includes a real-time dashboard tool, as well as Swiftly's onboard app solution for a subset of Miami's fleet. With that context in mind, I'll skip ahead to why we are all here, the case study presentation for Miami. So Miami-Dade Transit is undertaking an expansive community-driven bus network redesign project to support the regional effort to move towards a car optional feature in the Miami-Dade area. And without further ado, I'm going to hand it over to Carlos and Linda to walk us through that bus network overhaul and how they did it and how they engaged their constituents during the process. So I will hop off my share and hand it over to Carlos.
Excellent. Thank you, Tim. I'm thrilled to be here today and very much looking forward to the conversation. I just kind of scanned and glimpsed through the list of attendees. I saw a lot of familiar names, so looking forward to that conversation after. Just to let you know, Tim, I have something for you. Is I dropped in a few palm trees throughout the presentation, so at the end, when I ask you how many palm trees you see, just to make sure that you're paying attention. Guys, we all have seen this image in here. We all have experienced how our lives came to a halt at the beginning of the health crisis. And just like many transit agencies, Miami-Dade County and DTPW in particular, severely cut transit service at the beginning of the Safer at Home order. Now, immediately after this happened, we started to restoring our services to full 100% of most of the routes that we have. We kept some routes suspended, mostly express services and kind of intercity, interregional services. We eliminated overnight runs to repurpose those resources during the daytime and added supplemental services above and beyond what we had pre-COVID. With over 120 additional buses deployed, some of our routes had effective head weight of about 5 minutes. So you can see how 2020 ridership and 2021 ridership compares respective to the 2019 pre-COVID ridership. I have here this graphic. The horizontal green line is the same, the ridership corresponding to the same month in 2019. The solid black line is the system-wide average, and the solid red line is the average for the top routes that I have here showing the screen. And you can start seeing how after the pandemic hit in March, April, we started to picking up our ridership to even go above what we have in 2019. And in our approach to deploy, the survey was not random. We were fortunate enough, we were very lucky to have been working with the Transit Alliance, a local advocacy group, and our friends at Jared Walker and Associates to develop a full bus network redesign. And in the fact, we actually unveiled our plan in February 2020, just before the pandemic hits. We already had planned for a high frequency network. And then we look at that data and the recommended from the Better Bus Network and look at the ridership that we have on our routes. And it is very consistent, the fact that we were proposing high frequency network, but we also have most of our ridership being carried by just 10, 15 routes on the top. So we start looking at how we're going to put additional resources in those particular routes in order to carry the most people as efficient as possible. And then by taking our real-time passenger information, using that load on buses, feeding it real-time to our friends at Remix, we're actually being able to visualize the passenger loads on our buses quickly and start identifying what corridors, what section of the corridors we need to start putting the services in. And that's what we start seeing, where we start implementing a service increase throughout the entire year, starting in May, July, August, September, November, January, all the way through March. We started to continue to increase our services, and it was not until June of 2021 when we scaled back significantly on our social distancing requirements, and we basically took away most of the supplemental. What we learned through all this effort is that frequency truly matters. We did all the same things that others did too. We did the cleaning, the sanitizer on board, the PPEs, partition for operators, air treatment, outdoor boarding, but notice that frequency was what keeping our Miami residents on the move. In service all day was crucial. Midday service and afternoon service was crucial. Our supplemental services continue to operate throughout the entire day, not only during the peak time. But ultimately, we found out that elements of a transit network always work. It is what it is. Basically, whether you're in the pandemic or you're not, make sure that you have frequent, fast, and reliable transit system. It's going to work even in challenging times like 2020. So from there, we went back to our drawing board. The Transit Alliance took the leadership in terms of managing the project and the community outreach. Our friends at Yadawaka and Associates took the technical leadership, and our entire team of service planning and scheduling and members of transit operations rolled up their sleeves to deliver the plan. But it doesn't end there. We work with many local stakeholders and partner agencies, and most importantly, Tim, it was the participation of thousands of Miami-Dade County residents that have made this effort, want to replicate in the transportation industry. From the typical online surveys to social media and email outreach to almost 180 community stakeholder meetings and the occasional pop-up meeting at the transit stop, the Better Bus Network was by far the largest community engagement effort that we've done in our recent history. So we started by listening. We asked our riders, do you think we should be changing the system to a system that can carry more people more efficiently? And 84% of them say yes. We went to details asking for their priorities, what they like to see, waiting as little as possible for the bus and getting us to my destination as quickly as possible were by far the most kind of supported. In addition to that, to our surprise, people say, you know what? I could walk a little longer if that means that bus is going to be coming more frequently and it's going to be faster. So then we developed jointly the Better Bus Network, right? And I know, Tim, this is a very small map and perhaps it's hard to read, but I want to draw attention to the colors in here. Green means every 60 minutes or less, blue every 40 minutes or less, 30 minutes or less, and red every 15 minutes. So the existing map on the left, you start seeing that they have many route deviations and high duplication of services, creating a network that is not conducive to move people efficiently. There's also a lot of green on the Better Bus, on the existing network, where you have routes running every hour with some of better free ridership. On the proposed plan, yes, we took away all the deviations and the duplicated service, but most importantly, we started introducing a high frequent network throughout our system. And that's where we start seeing the priorities and the benefits. But the biggest benefit that we see is when we look at the same map in the middle of the day. Many green lines become blue, many blue become red, and the pink, which is every 7.5 minutes, start to appear. And this is very consistent to what we learned on the ridership that we have today through COVID and the areas of focus that we wanted to address as part of the analysis. We talked about faster journeys. This is what we look when we talk about that. We focus on the entire journey. If we have a 30-minute route connecting 30-minute route, the way we do this is averaging the waiting time at the beginning of the route and a transfer point. And if you compare someone that will be waiting 15 minutes on average before the trip and 15 minutes on average, and the connection and transfer point, when we go to a high frequent network, that waiting time gets cut in half, and we go now to 15 minutes in total, 7.5 on the beginning, 7.5 in the transfer point, for at least 15 minute savings in terms of the travel time. And by removing some of the bus stops throughout, we start seeing that we can be more reliable, faster, and consistent service. And we're going to see this type of improvements throughout Miami-Dade County, with 49 out of every 50 residents will have a same or better service with Miami-Dade County Better Bus Network. In particular, looking at the communities of focus and concern, the seniors living within a 5-minute walk of transit high frequency network, we're going to go up from 11% to 23%. The communities in poverty will go from 12% to 28%. Communities of color will go from 9% to 23%. And the way that we do this is by really expanding on our high frequency network Today, we only have about 4 corridors that serve at that high frequency, mostly serving the beach and some of the downtown areas. The better bus network is gonna increase that by 4 times the number of corridors, increasing that footprint in high frequency network. And then these benefits are reflected throughout the entire county, but the best way that I can actually explain this, and this is basically coming out of the Jared Walker University here, is how many more residents, how many more jobs are really accessible within that wall around your life with that 45-minute window using transit. And as an example, Coconut Grove residents will be able to access 60% more jobs, and 165% more residents will be able to access the jobs in the Coconut Grove area. This is transformative, and this is the type of improvement that you see throughout Miami-Dade County with this improvement of the Better Bus Network. So it was no surprise to us when we started asking our residents, now that you have seen this effort, would you support it? 89% of the respondents say, yes, I want this type of improvement going forward. So fingers crossed when we go to the board next week to get it passed. It's been a long journey. There's a lot more to go, but I'm really proud about the work that we're doing together. Our team, service planning and scheduling, really step up to the task in order to get delivered on this. So yeah, the Better Bus Network does a lot of great things. It is a community-led environment and network redesign. It's the first one that's been done in Miami-Dade County since the introduction of the Metro Rail back in 1980s when things were very different, and really shows some transformative elements such as increased access to frequent bus routes, improved off-peak service and faster journeys. All these things reflected through the community input, through the data collection and the things we've done. But we're not going to end there, and it is a type of conversation that I would love to pick up from here, Tim, is, we've done a lot of information and gathering in the back. We've done a lot of kind of looking at the data and the development of a new plan, but it doesn't end there. This is a better system means continue to improve. We're going to continue to monitor the performance. We're going to identify ways to improve, and we're going to adjust as necessary moving forward. We have the will, we have the commitment, we have the community supporting us, and most importantly, I think we have partners around the nation that support this and great tools that can help us achieve what we need to do. So I'm really looking forward to this conversation. I know it was 3 years of effort were condensed to just about 10 minutes, but I do appreciate the opportunity to work with you guys and the rest of the team in service planning and scheduling, the Transit Alliance, and Jared Walker and Associates. We really have done a great effort that can be replicated not only in transit agencies across the nation, but in other projects for Miami-Dade County.
Wow, thank you so much, Carlos. And that was an incredibly informative presentation with just fantastic slides. I'll take that back over now to kind of jump into our Q&A portion. Just give me a second to share this screen. Yeah, I think we have lots of questions I want to dive into around the different things you mentioned, the plan itself, the community outreach component of it, and the analysis piece afterward to keep iterating and evaluating its progress once it hits the streets. And I think I only noticed 2 palm trees, so maybe I missed some, but I was looking for them throughout, but I think I only found 2. So
come on, Tim, there were 3, but yes, you got close. You got close to it.
All the real content here. So, but yeah, so I think to start off, I want to drill in more actually on the community outreach piece, what you were doing. I know it's of interest to a lot of other agencies who are considering a redesign that might follow the same principles of focusing on high frequency corridors and rededicating service, making things faster, all the things you were doing. But needing to garner support for that is so important because it does involve trade-offs, and you want to, of course, make sure that the community is involved and well heard in the process. So going back to the community outreach strategy that you briefly touched on, actually, I can probably quickly scroll back and even find this slide. It was this one. I wanted to just ask, if you could talk about the components of the community outreach that you think went the most important that you'd recommend, and also if there's anything that you would do differently in the future.
Sure, and I can start on that. I think the process we were very lucky in the fact that we had Transit Alliance kind of initiate the whole project to begin with. So it started from the community, it started from an advocacy group. And they really took the lead in going out and making sure that every part of the community was engaged in the process. They led the 180, I think, workshops within 18-month period, which is huge. And it's not something that we could have done as a department. We just wouldn't have had that resource to be able to do that sort of outreach. Obviously, we did partner with them going forward with it. But I think the key to success for us was really that they initiated the whole process. So it was, as we keep on saying in the whole project, it was community driven because it came from this advocacy group, which we then partnered with.
Yep. Tim, and I think the most important thing is to listen, right? And this community outreach is not the one time, the week-long event that we go out there and get information. This has been from the beginning, right? We started with concepts, right? This is the ridership concept. This is the coverage concept. We went out to the community and say, what do you think about this? We started with choices, right? Now we need to make choices. If we have this, what you have to give away? And we went back to the community. Then we presented a plan before COVID, and we went back to the community. Through COVID and now with the adjustments, we went back again with the community, right? So all these things are really part of the conversation. And one thing that I failed to mention is, while we do have high frequency network, right? And I didn't want to kind of make sound that we were disparate impacts. Our community asked us that on the southern end of Miami-Dade County to maintain coverage over ridership models. So that was part of the effort that we had, right? We asked them, you have choices, you have concept, what you want to do. I want coverage, I don't want to lose any service. On the north side, it was more about, I really want to see a ridership model when I can move faster with more efficient system, right? So to me is, we started with one idea, right? And to all transportation planners, we come with an idea, we want to implement something, but ultimately you just have to take that and put it aside and listen to the community and get that information to adjust it properly.
And one thing that I'd want to add as well is that, well, what's focused on the slide right now, it's all public engagement. I think a real key part of it as well was we did a lot of internal engagement with our operators and our operations staff. Getting that buy-in is critical in order to get the project approved. So we spent a lot of time with our unions and our operations staff kind of going through the details of the plan to get that level of buy-in as well. So it's outreach and it's in reach as well.
Very, very thoughtful point. That's really interesting. Definitely, I can see how, if not done that way, maybe you'd have lots of scrambling later on or something to adjust for internal concerns. That's very thoughtful. Well, great. I'll hop back down to our other Q&A slide. And the next question I have is kind of more on this point that Carlos is talking about, of just kind of making sure you're monitoring and adjusting going forward, even after this plan is put into effect. And I want to ask kind of what are your, given the overall goals of it, how do you plan on evaluating it, once it's in action, assuming, board approval, and we're now in spring or summer of 2022, and you're 6 months into the new network. What does it look like to evaluate this, and what kinds of metrics and data will be really important for you to examine?
Sure. I just want to first point out that Carlos really tried hard to make that acronym of MIA, Miami, making sure everyone understands that that's what that is. So yes, monitoring the service. Obviously, once we implement, we know that on day one, that is not going to be the plan going forward. It is not going to be perfect on day one. And kind of actually learning from Houston, we spoke with Christoph Spieler, and they talked about having kind of initial 2 weeks of just kind of an emergency room with operations and planning, and making sure, anything that they can adjust in the first couple of weeks, they could do so. So obviously there's like an initial period where we're really going to be very hands-on with the service going out there. And then it takes a while for things to really bed in, right? I know that we have to do like a status report to our board 6 months after we start. Even 6 months is not going to be enough to really know what the network is going to be doing. But what we're going to be doing during that period is looking at the wonderful tools we have available from Swiftly and figuring out what's happening with our on-time performance, our ridership, obviously. But one part of the plan that Carlos mentioned was we're consolidating a lot of stops. We want to make sure that leads to actual speed improvements. I think, we talked about the consolidation, but the magnitude of it, some of our stops are every block, as I'm sure a lot of agencies have that problem as well. What we're proposing is removing about a quarter of our stops. We have a lot of stops in Miami-Dade County, 7,500 right now. We're looking at removing about 2,000. So that's a huge effort in itself. And we want to make sure that we're getting the gains from that enhancement. So that's really key.
Yeah, and in addition to that, Tim, we built this with the community. We built this with asking them what you want to see, right? And even if the Transit Alliance trying to get away from us, they're not gonna be able to, right? So we're gonna continue to ask for that qualitative data that can help us make decisions, right? So you can expect us to continue to be out there asking, now that you have the plan, are you really getting able to get to more places? Have you changed your travel patterns, right? Are you able now to rely on transit for other trips that is not just going to work, right? All these things, again, this is the type of the purpose of why we're doing this. So we want to make sure that we measure again those purposes as well.
Gotcha. Yeah, that completely makes sense. I think you definitely want to make sure folks are getting there faster at the end of the day, that you're reaching that.
Mm-hmm.
So I want to shift gears quickly because I know I want to kind of wrap up this portion and get to some audience questions as well. But I want to shift gears and ask one question around what happened during the pandemic specifically. I'm curious to learn if when you were able to do that temporary increase in frequency during COVID that you showed those ridership slides on earlier in the presentation, has that been helpful in kind of the final phases of approval for this project? And do you see value for other agencies considering a redesign and kind of doing trial and test experiments, if you will, to kind of implement some of these concepts and see how they're working? I know, of course, that wasn't your impetus for doing this. It was a response to an emergency situation, but there was also an ability to bring forward this concept kind of ahead of schedule and trial it out. So I wanted to just hear from you around how that went and how you feel about that kind of thing for other agencies considering this.
Yeah, and I'll start this one and then let you jump in. But we added resources because of capacity restrictions and limitations, right? Like we went down to about 25% of capacity in bus, right? And because of social distancing, and we were leaving people behind, right? So we started adding resources to provide at least some trips for those, but without noticing, we're actually adding frequency, right? Instead of being every 15 minutes, we have routes every 5 minutes. So all of a sudden it becomes very, very, and enticing for the community to say, you know what, I'm going to get on that bus and go somewhere because I can be there faster, right? So to me we're able to see the byproduct of having a frequency service and what that means. Capacity is one thing, supply is another thing, and having supply that it meets the demand of in terms of what the people want to see on a service experience, it is of value. So to me we're looking at the increase in ridership, and I'm like, I was telling the director and the chief operations officer earlier this year, these exact improvements that we're doing during COVID, adding a lot of vehicles throughout the day on these routes, it is the base of the better bus network. So this is expected that we can see that ridership increase by increasing that. So the way we did it was very simple, and perhaps Linda can expand on it. Yes, we put a lot of effort from service planning and scheduling, but we started putting runs in between runs. Basically, just started, and it was not consistent. I'm not going to tell you that was perfect, but we started looking at those sections during the day that we needed to have more service and throwing a run in between, so that way we can actually get more capacity and also less waiting time, and we saw that increase.
Yeah, very cool. Really interesting part of the whole story here to do that. Well, I want to turn to quickly address a few audience questions in our last minutes. So one is just how did you evaluate demographic impact for this?
I'm sorry, Tim, what was that?
How did you evaluate demographic impacts of the redesign?
So the work that Jarrett Walker did, in terms, and I think Carlos showed some slides as to how the improvements work with different demographics. It's just overlaying the demographic layers in. I think we can even do this in Remix. I'm not sure exactly how Jarrett Walker did it, probably using GIS. But essentially, looking at the network and seeing the before and after effects based on census block and demographics within that census block. One thing to note as well is that, and I probably should have said this up top, is Miami is unique in the fact that it's a majority minority county. So we're actually 85% minority population, pretty much covering the whole county, which is interesting.
Yeah. So on that note, what I would say is, we build a plan asking people, do you want a frequency? You want coverage, right? We build a plan talking about high frequent network works, right? So the way that we calculate the impacts is identifying those corridors that you have every 15 minutes, every 10 minutes, every 30 minutes, every 60 minutes, and see how many people can actually have access to that within a walking distance, right? So by start seeing that, right, and let's be honest, we took away, there's some routes that is going to have less frequency during the peak time, but then we increase the frequency during the daytime, right? So now the impacts or the benefit goes, not only I'm near a transit service that is within walking distance and it's frequent, but I'm near to that transit service all day, right? And I don't know if you guys, but our community, we often talk about the transit dependent. That was the term that we used before. Then became essentials. It became essential employees, and their schedule is not like yours and mine, 8 to 5, right? Their schedules are off peak. And I think this is really of value to understand that benefit off peak in those areas when you need to provide better service and you can walk to it. It was a key factor for us. So we're measuring that as a proxy to say this is good for the community or this is a bad, right? So that is to me one of the key elements to measure.
And I think that's really key in how things shifted during the pandemic as well. And people now understood the relevance of the off-peak and the essential workers. Prior to that, we had been saying this message, but people didn't necessarily understand it. Suddenly in a pandemic, when there are people doing all these shift work and there are essential workers, that message really hits home. So I think that really helped kind of sell the whole plan as well to people who didn't quite understand that concept.
Mm-hmm. And that discussion around like access to employment specifically touches on another audience question actually, which is someone asked, I know you mentioned did you engage employers and learn about the needs of their kids?
So we use residents and jobs, and jobs in particular as a proxy to everything we do, right? Whether we go to a restaurant, we go to a hotel, we go to the pharmacy, there's someone working there, right? So to these access to opportunities, access to activity, it makes sure that you have all the different things that you need to do within your reach in transit. And we use 45 minutes in terms of travel time, which again, that means that you're going to continue to increase accessibility within 60 minutes and beyond. At the same time, for employers, I think there's a good opportunity to talk about. By doing this, we're increasing the opportunity for people living within the accessible area by sometimes 200, 300%. That can really allow for employers to tap into a larger market to tap into. And at the same time, give our residents more opportunities to find jobs throughout.
And someone asked another question too, I think, which relates to the piece before, kind of on the analysis and development of this, was how do you, Linda, you mentioned earlier that the amount of stops that were removed as part of this, and I'm sure a lot of thought went into that. And they're kind of, the question is, how did you use qualitative feedback that you heard from the community to evaluate which of those stops? What were the factors in figuring out which stops?
So in terms of the which stops, so Carlos showed the results of the survey where we just kind of have the generic, like how far would you be able to walk? But when it drills down to the actual stop locations, we didn't necessarily get feedback from specific stops. We obviously told people the list of stops that we're planning to remove. Some people, came back to us saying, they didn't want certain stops removed. Obviously, that happens everywhere. And so we would look at that feedback. But our team, looked at key factors, making sure that we weren't removing a stop in front of a senior center, sort of generators. But the whole kind of principle of the plan is we have a lot of stops that are put in by politically driven motives that are on every block. And so it's really just kind of stripping out that kind of unnecessary layer that's there. And really not affecting many people's walking times. The majority of the stops that we're stripping out are superfluous stops that are at every block.
Perfect. Thanks for answering. And another question was just about kind of your service in general, about whether you have both commuter and local services, and if so, was your approach different between those two?
So in the plan, commute service was not included as part of the kind of redesign of the plan. Maybe Carlos can talk more of it as he was there for that part.
So we do offer some commuter services, but we call them express routes, mostly on our highways and freeways. What we did in this plan is, we kept them untouched, right? So most of them that were going from Broward County to Miami-Dade County as an express service. Now, we also have some overlapping routes. And Miami-Dade County, is big. It's bigger than some states. So even our local routes in our maxes, which is basically limited stops on a local route, are long, can be considered commuter services. So what we did with those is we consolidated the local service with the max service, basically standardizes the bus stop spacing and trying to then maximize the resources and move those as fast as possible. So it's going to be an interesting approach to this. In addition, of course, we also have another project called the SMART Plan, the Strategic Miami Area Rapid Transit Plan. We're expanding our rapid transit system by 80 miles. We're under construction right now on a full, gold standard BRT down south that's going to be part of this. So for those kind of longer haul services, we're going to have rapid transit services on it, and then the Better Bus Network to be that solid foundation to build on top of that. And we expect more of these express routes, right, Linda? We have parking rights on the west coast, on the west side of Miami-Dade County. They're going to take the Miami-Dade Expressway Authority 836 route to get to downtown. We still have some of those, so they're going to remain. But our focus was on locals and moving locals faster, because the activity, right, and the performance rate, if you will, for the locals is a lot higher. For every vehicles in the locals, we move a lot more than on an express route or commuter route.
And I want to kind of close out with one other bigger picture question, which was, we talked about the goal for the region to kind of help promote a car optional feature and reach and kind of have that be a lived reality for folks in Miami-Dade County. And I want to ask sort of, how does this bus network redesign fit into that goal among the other different kinds of things that you're doing?
So to me, it first restructured the foundation, right? We can continue to talk about improving and building on top of this by solidifying the foundation. This is making a strong first step towards moving forward, and by then concentrating efforts on high frequency corridors, all of a sudden transit becomes something that is very accessible through our entire day that you don't have to think about. You walk through the bus stop and you have access there. At the same time, one of the things that we learned through COVID is that we don't have to run everything ourselves, right? So we took overnight service and took it away to put those resources during the daytime to fulfill our capacity needs. But we didn't want to train people away from transit. So instead of leaving them behind, we introduced a voucher program with TNCs for overnight services. So all of a sudden we started saying, even if we might be creating some transit desert with a better bus network, we're fortunate enough that we're never going to be creating a mobility desert, that we have opportunities for us to run voucher programs with TNCs, with taxis, that we can introduce micromobility access to some of the stations. We do have the Go Connect program with our partners in VIA that actually already showing an increase in ridership in some of the areas feeding into it. So to us is, bus is the key, is the foundation. Bus is, 4 out of 5 riders in between rail and train and buses are on buses today. So we need to make sure that the riders are using that today have a better service, and we need to make sure that it's a service that can attract more people. Ultimately, it's just going to be the solid foundation. From there, bicycles, scooters, taxis, TNCs, microtransit, all the different elements come in. And not to forget that we're not alone in this. We have 34 municipalities, and they do have also their own local circulators and their own on-demand transit vehicles, right? So we're building, to me, and I said it again, because better means that we're going to continue to build on top of it. Better means that we're building the best foundation today to build on top of that, and I'm really enthusiastic about that moving forward.
Yeah, great. And so I guess maybe also for folks who aren't as familiar with your geography, could you explain a bit about that second piece too, about how, there's service provided by Miami-Dade County that you're kind of focusing on in this effort, but there's also lots of other transit service, right, that kind of overlaps in some ways with your geography. Could you talk a bit more about that for folks who aren't as familiar?
I don't know, you want to chime in? Look,
Well,
hold it back.
so
So yeah, that we are within the Department of Miami-Dade County. We are the providers, if you will, of public transportation in the region. However, we do have 34 municipalities with about, I think I want to say 29 of them run their own local circulators, whether on demand or fixed route, in partnership with some of the other municipalities too. Often our routes with one or two vehicles. Often the cities or the municipalities have one route, two routes. Of course, City of Miami being the biggest one, I think they have 12 routes with almost 50 vehicles running in the peak time. Miami Beach also have their circulators. So to us is, we are responsible for regional mobility. We're responsible for that access throughout Miami-Dade County, crossing boundaries and jurisdictions, and the municipalities can be a fully complementary resource towards what we have. That doesn't mean that we're not going to be part of providing local service. We are, of course, bringing a lot of capacity on this realm. And one of the things that we're going to be doing with the Better Bus Network is setting the tone, right? This is what we mean that transit needs to work. And from here, the next step is working with the municipalities to continue to enhance and accommodate their services to our system. And we need to start doing that by introducing into GTFS and GTFSRT and make sure that we have one single trip planning tool for the entire region. So hopefully is all the resources in one. We had 99 routes today. We're going to go down to 79 routes, maybe 80 routes with a better bus network more efficiently. The municipalities have, I want to say, I don't know, over 60, maybe 80 routes in total. And we can work on this together moving forward. We plan to launch the Better Bus Network towards the first half of next year. And simultaneously, as we go through the implementation of the Better Bus Network, we're going to start seeing municipalities being part of our system in terms of the experience. We already have Coral Gables integrated into our trip planning. Coral Gables trolleys already in Google Maps, Apple Maps, Transit app, Move It, Uber, Lyft, Go and Connect, Go Nightly, all these things already included. The next one I think is going to be Miami Beach. We're going to continue to do so. So I'm very enthusiastic about that and the integration. Ultimately, these colors that we put on a map about jurisdiction and the distinction between one route and the other, when you're on the street, when you're on the bus stop, you don't care, right? You just want to go to where you need to go. And that's what we're trying to make sure that we facilitate that and become that mobility management agency that can allow for facilitation of mobility in whatever form that is and whoever provider that is.
And to borrow a phrase from my Bay Area friends, we are trying to create this seamless network, right? And I think the issue is we did actually originally include some of the trolley networks within the Better Bus plan pre-COVID. When COVID hit, because of budgetary issues at the various municipalities, there was a sense we should take out the trying to integrate trolleys at this point. But that's definitely kind of the next phase, I think, of what we need to work on is making sure that the network complements each other. Because certainly there is a lot of overlap now with some of the routes, and that's definitely something we can work on going forward.
Mm-hmm. Yeah, it's a really fascinating problem, and we're excited to be partnering with you on that and kind of the solution, just synchronizing the information for all these services as much as possible. Well, great. I think this brings us basically to the end of our time. So I'm going to close it out now, and I just really want to say thank you for your time so much, Carlos and Linda, for sharing that presentation and those beautiful slides and helping us establish such a wonderful partnership with you at Miami-Dade Transit. Our team will follow up with a recording of this webinar. And if we didn't get to your question, a Swiftly team member will follow up with you directly. And as a note as well, if you want to dive in more to those really beautiful slides that were shared today, you can find great information about them on Miami-Dade's website as well. So thank you all so much.
Thanks.
Bye-bye, everyone.